Now, the concept of transplantation goes beyond the face. There are, as we have learned, there are a lot of other possible applications where this could be used. And here are some examples of soldiers that have come back. Some of them do well with prosthesis, but no matter how functional you are with prosthesis, there's no question that the living equivalent of your hand or lower limb with sensation, with the ability to walk without putting prosthesis on, is just so much better. So Richard is our patient that we transplanted both hands on, and I wanted to play a short video about his life.
From his earliest days, Richard Mangino has had a true passion for music. He took a familiar path while growing up in East Boston. He got married to his dear Carol. They had 3 children, and for 37 years, Richard worked at Logan Airport as a ground crew director. The music lived on in his family, but in July 2002, the tune suddenly changed. Richard had developed sepsis, and the infection in his blood was ravaging his body.
I had never heard about sepsis or a kidney stone doing this much damage, and they said, you know, his fingers might start to slough off. And I'm saying, slough off.
To escape death, Richard made the difficult decision to allow doctors to amputate his 4 limbs. Richard was suddenly a quadruple amputee. Somehow, Richard always managed to find a way around the challenges of his new life, with a smile on his face and a ready laugh. When Richard heard they were performing hand transplants at Brigham and Women's Hospital, he was determined to get new hands. Richard knew he would receive the best possible care. Brigham and Women's Hospital had previously performed 4 face transplants, including the nation's first full face transplant. The surgical team had spent months going over every detail of his complex case. In October 2011, with his charming exuberance on full display, Richard Mangino was wheeled into an operating room at Brigham and Women's Hospital.
The operation lasted 12 hours and involved more than 40 people, including 14 plastic and orthopedic surgeons.
What we performed was, in fact, bilateral mid-forearm transplants. This surgery takes 4 teams working simultaneously. A V-shaped incision is used to accommodate the swelling and to prevent scar contracture. Next, you'll see that the bones are joined with metal plates and screws. And next, the muscle, tendons, arteries, veins, and 3 major nerves of the forearm are joined.
Regardless whether it is face or hand, we now know that the brain rewires and regains control over the transplant, considering it its own part. What we're learning through this process will likely have far-reaching effects on transplantation as a field, but will also expand our understanding of brain function, nerve, and other tissue regeneration.
And for the surgical team, there was a defining moment.
I also want to draw your attention to one very special photograph. It shows the moment of reperfusion of the left hand. After connecting the arterial system, you can see blood bringing this hand back to life.
And in that moment, Richard Mangino received 2 new hands and a whole new life